Asking the expert. A couple of the questions that you guys sent to us about weight loss for Dr. Sonal Haerter. And you know what? I saw a clown out there feasting on something. So, you know, we get hungry this time of year. Holiday weight gain is a real thing. Viewer question from Sherry from Mesa. Can you help with menopause weight? I know you and Tram talked about the big M. So is there any luck here?
And Sherry, I hear this from my patients. And one of the reasons it's so hard is because your metabolism slows down, but also because of lack of estrogen. The fat distribution is in the midsection area. So here are some key things during menopause. It's staying active, but even more than active, focusing on resistance training and weight training 3 times a week, along with protein intake. I keep insisting on this. We don't eat enough protein, but fiber and protein and weight training, that is a way, and staying consistent. These changes are slow.
Right, yes, don't get impatient. Try to keep the faith. All right, next question coming from Heather over in Chandler. How can I suppress my appetite? If I wasn't so hungry, I wouldn't eat as much. So
absolutely.
How do we beat
to
that?
suppress appetite, 2 things. Fiber, that comes from actually natural foods. So like legumes, lentils, whole fruits and vegetables, that's one way. About 25 to 30 grams of fiber per day for an adult. That's a lot of fiber. Also protein, again, going back to that, 20 to 30 grams of protein with 3 meals in your day. That is going to satiate you. And then if you do qualify for weight loss medications, some of these weight loss medications change the brain signaling, suppressing the appetite.
Okay, there you go. And that's from Chandler. And then Sadie in Phoenix asks, what are your thoughts on using Ozempic to lose weight? I know, again, you guys have touched on the weight loss drugs, and for some people it's okay, but you don't just want to go willy-nilly into something like that.
Correct. And Ozempic-like medications have existence in 1994, so they've been around for a long time. Some people do qualify for the use because that is the only way sometimes we can assist them with their lifestyle modifications. However, like any other medications, these medications do have side effects, and hence very important that they are used appropriately in the right type of people, where you weigh the risk and the side effects.
Sure.
Exactly, and then supervised by doctors.
Exactly, and as we've said before, these are general guidelines. You do need to consult with your personal physician. Obviously, we are asking the expert here in studio, but again, you need to consult with your doctor before making any rash decisions. We do have a question from Jane over in Mesa. Do you think that drinking a shot of diluted apple cider vinegar daily will help me lose weight? If so, how exactly does that work? I saw this weight loss tip online. I've seen it myself as well. Thoughts?
So Jane, unfortunately, we don't have enough scientific evidence to back this up. I would say hydrate, so dehydration doesn't become a reason for us to think that's hunger. But the apple cider vinegar, we don't have enough evidence on weight loss.
Okay, so maybe just incorporate it for other purposes, not necessarily for weight loss specifically.
Correct.
All right, final question coming from Brian over in Tempe. He says, what are the most effective diets for losing that stubborn belly fat? Is there a certain time of day to avoid eating?
Okay, so for weight loss, we know that if you reduce the total calories in a day to balance your energy expenditure, calories in and calories out. So also avoiding processed carbohydrates or processed foods in general, and staying active. And time of the day, I would say avoid late night snacking. I think have a cutoff time about 7 p.m. and then no food intake post 7 p.m. I think that would be.
That would be recommended. And we did hear from our nutritionist earlier in the week that if you do get those cravings after that certain time, that maybe you've set your goal time to not eat after 9 p.m., snack on maybe frozen fruits, frozen blueberries, just to kind of tame the sweet tooth and maybe kill off the hunger. Have a big glass of water.
Correct. Like fiber, carbohydrates, something like that.
Yes, ma'am. Dr. Sonal Haerter, thank you so much.